Hi, my name's Rachel and I have done ECT, electro-convulsive therapy. When I first started doing ECT, I went on YouTube to find videos of other people that have done it just to see what the experience would be like, and I couldn't find any. I found lots of videos of educators and doctors explaining what ECT is, like the literal dictionary definition of what it is, but not any videos of actual patients talking about what the experience is actually like. So I decided that I would make a video and explain to the internet what ECT is actually like. Disclaimer, I am not a doctor or a psychiatrist or any kind of mental health professional. I'm just a woman on the internet who has done ECT. So if you have any questions, talk to your primary care physician or talk to your psychiatrist. Don't come to me. I don't know anything about your diagnoses. Like, your doctor is definitely the person you want to be talking to. Okay, moving on. Step 1, you get admitted to the hospital. Step 2, you talk to a psychiatrist and they get your consent. Step 3, a nurse takes your weight and blood pressure. Step 4, you walk into the OR and have your ECT treatment. Step 5, you wake up and go home. I didn't do ECT just out of nowhere. I have clinical depression and have for many years. I've tried a lot of different things. I've tried individual therapy, group therapy, nearly every antidepressant on the market, and a lot of different mood stabilizers. And after a couple hospitalizations, my doctor decided to talk to me about ECT. And it seems like kind of an extreme measure, but it was right for me personally. Step 1, you go to the hospital and you get a little wristband that admits you to the hospital. It has your name, date of birth, maybe an ID number, and the name of the hospital on it. Next, step 2, you go and you talk to a doctor. You talk to a psychiatrist who is familiar with your condition, and they give you a survey called a PHQ, I believe, and it has questions about it. How sad are you? Are you able to sleep at night? Things like that. And if they look at your PHQ and the psychiatrist talk to you and they decide that you meet their criteria, then they okay you to have ECT that day. They also, as you do ECT, it messes with your memory and how you have cognitive side effects. And so they ask you about those every time that you go in for subsequent ECT procedures, treatments, I guess. So they ask you things like, do you know what the date is? Do you know where you are right now? What did you have for dinner last night? Who did you last talk to on the phone, to try and gauge what your short-term and long-term memory is, to see if you are okay, and if you're not okay, then they'll sometimes bump your treatments out. So for example, the usual treatment schedule at the hospital where I went was 3 treatments a week, but because I had higher than average cognitive problems and memory issues, they spaced it out so I only had 2 treatments a week. This is totally normal, nothing to freak out about, just everyone is slightly different. Next, a nurse will come in and they will take things like your blood pressure, your weight. They took a urine sample the first couple times, but I think that was just to see if I wasn't pregnant, and afterwards I asked them for a form and I was able to sign a form instead of giving a urine sample every time. They also put an IV into you because you need that to receive the anesthesia. After they've done that, you get to walk into the operating room. It's a very weird experience to walk into an OR, because normally you're wheeled in on a bed, so it just feels very informal to just be in your street clothes, hey, doctors and nurses standing around, just casually walking into an OR for a procedure. It feels very strange, but you kind of get used to it. So you lay down on the table. They took my shoes off. I don't know why they did that, but that's just a thing that they did. They attach different monitors to you. They do a blood pressure cuff on your arm, and then they put a blood pressure cuff. I'm showing you, you can see my ankle. They put a blood pressure cuff on your arm and one on your ankle. And they ask you if you have any loose things in your mouth, like dentures and stuff like that, because you have to take those out because there could be problems. They put a blood pressure cuff on your ankle so that your foot actually twitches and moves. The rest of your body has a muscle relaxant while you're doing the actual treatment, but your foot will actually seize so they can see that the seizure is actually occurring. They hook up different little sticky pads to your chest. I think that's to measure your heartbeat, and I don't really know. I'm not a doctor, but I'm just telling you what they do. Depending on if you're doing unilateral or bilateral ECT, they put another larger kind of sticky pad that's attached to a wire either only on the right side of your head or on both sides of your head, and this is the thing that's actually giving you the electric shocks. It doesn't feel very official, but I am told that it definitely works. And then they take your IV and they hook you up to, you know, the IV stand that has the actual fluid in it, and then a nurse or a doctor asks you for your verbal consent and your name and date of birth, just to make sure that they're not accidentally giving ECT to the wrong person, because that would be bad. When the anesthesia goes into your IV, it like burns a little bit. There's like something to do with the way that it interacts with the fat in your body. It has kind of like a sting to it when it goes in, and then you just fall asleep and then they do the treatment. 30 minutes later, you wake up, and that's it. You're a little groggy, and you definitely need someone else to drive you home, because you will be groggy and like way out of it once you wake up from the anesthesia, but I think that's pretty obvious. I don't remember much else that happens. I know that I'm wheeled out in a wheelchair to my car afterwards, just for safety reasons, because you're a little like wobbly on your feet because of the anesthesia. Almost all of the side effects that you have the day of, besides cognitive ones, like physical symptoms, are all a result of the anesthesia, not the result of the ECT treatment, as far as my understanding goes. Then you go home. The rest of the day after an ECT treatment, you'll be kind of sleepy and groggy, so I recommend taking a nap. Definitely get lots of fluids, eat a good meal, because you can't eat anything 12 hours prior to the treatment because of the anesthesia. They want your stomach to be empty. So eat a good meal, take a nap, just kind of relax. Don't plan anything for the day of the treatment. Don't be like, oh, in the morning I'm going to do an ECT treatment, and then afterwards I'm just going to go take like, you know, a biology test in college or something. Don't do that. Once you do an ECT treatment, that's kind of like it for the day. It's like, treat it like a colonoscopy or something. That's the only thing that you are doing that day. So yeah, that's about it. That's what an ECT treatment is like. If you guys have any questions, leave them in the comments or direct message me or whatever. I hope that this helps someone going through ECT to understand a little bit more about what it's like from a first-hand perspective. This is the vlog that I wish I had had when I was starting ECT, so I hope that this can help somebody else. Thanks. Bye.